Well, good afternoon, and thank you for joining this important conversation about how we can enjoy a safe summer here in Nashville Neighborhoods during the time of coronavirus. You know, I campaigned last year on restoring our city's focus on Nashville's neighborhoods, and now more than ever, during this time of historic challenge, we need to concentrate on the health and well-being of our neighbors. Individuals, working families, those over age 65 are all facing hardships, but are learning to live and work with the coronavirus. Now, we don't have all the answers, as we have said before, but together we're going to find the right answers as we work towards a sustained recovery that will get Nashville back to work, school, worship, and play without interruptions. Now, we want you and all of Nashvillians to have a safe, healthy summer, and we hope that the information provided on this webinar will be useful to you. And again, I am grateful to all that you do to make our neighborhoods vibrant and safe. Thank you. And with that, I'd like to introduce Dr. Michael Caldwell, Director of Metro Public Health, and someone who's been instrumental in getting our city into its current state of phase 2 of recovery. Thank you.
Thank you, Mayor Cooper. It's a privilege to serve side by side with you during this time of our community. I feel a great sense of calm and confidence that we are moving in the right direction, and to be here today with the announcement that we are able to move from phase 1 to phase 2 on Monday, Memorial Day, is quite an event to be recognized. This webinar today, Safe Summer in Nashville Neighborhoods, is something that I'm so pleased that we're able to be able to share with you, with the great participants that we have. I'd like to remind you that the Department of Public Health of Nashville-Davidson County is here for you. We're a partner with you. We still have our hotline open every day from 7 a.m. to 7 p.m., and that number is 615-862-7777. That's 615-862-7777. That is your interface with the Nashville-Davidson Department of Health about COVID primarily, but any other way that we can serve you at the Department of Health. This Friday and Saturday, May 22nd and May 23rd, we'll continue to be giving out face masks from 9 a.m. to 1 p.m. at the community centers at Hartman Park Community Center on Tucker Road, the Bellevue Regional Center, the Madison Community Center, and the Smith Springs Community Center. I hope to see you out there. We'll be giving out face masks to all who come, as well as some infographics and other educational materials to help you learn more about COVID and how you can make sure your families are safe and your neighborhoods are safe. Now, today's webinar, we got a great lineup and a lot of great information. But before I do that, remember, you have a chat box. You could start asking your questions right now. There's a Q&A chat box. Start asking your questions now if you have them, and we'll try to answer them during the webinar. This will be recorded, and we'll have all the resources at the end. Today, Dr. Alex Jahangir is going to be talking to us about just the nuts and bolts of coronavirus and what our current updates are. He is the chair of the Nashville-Davidson County Board of Health. He's also chair of Mayor Cooper's Coronavirus Task Force. After Dr. Jahangir, we're going to have a great panel on brains and brawn, resources for keeping mentally and physically active during coronavirus. I'm pleased to welcome again Jessica Fain, the Chief Strategy Officer from YMCA of Middle Tennessee. She'll be talking about child care camps as well as online resources. Then we're really lucky to have Deputy Mayor Brenda Haywood with us today. She'll be talking to us a little bit about food resources that are available in the community. And then our great Director of Metro Nashville Parks Department, Monique Odom. She'll be joining us to talk about pools, playgrounds, and more. And then we'll have a Q&A answer period. So remember, use that chat box, start asking your questions now. And it's my privilege to ask Dr. Jahangir to take it from here. Thank you.
Thank you, Dr. Caldwell, and thank you all, and good afternoon. You know, I want to first begin by thanking all of you as Nashvillians for doing everything you've done to get us to this point. We now, as you may have heard this morning, announced that we're rolling into phase 2 of our plan effective Monday on Memorial Day. And the phase 2 that we're rolling into is a more comprehensive phase 2 than we had initially placed in our roadmap, and that really came about as a result of recognizing best practices, recognizing the great efforts of Nashvillians, and really working with our public health experts and other subject matter experts to roll into that phase 2. So very briefly, I'll tell you what phase 2 involves, and I will then hopefully add a few more comments here. So phase 2 will involve increasing restaurants to 75% capacity, retail also 75% capacity, personal care, so hair salons, nail salons, tanning, so forth, will be available at a 50% capacity. Fitness centers and gyms. I know this is very important for a lot of our neighborhoods and HOAs. If you have a community fitness center, 50% capacity. Museums and attractions as summer comes, whether it's you know, the zoo or Cheekwood or the Adventure Science Center, places for us to go as families will be open now at phase 2 with some capacity restrictions. Day camps, very important for a lot of families, myself included. Day camps will now be open with some guidance and some restrictions. An important thing is community pools. Again, a lot of our neighborhoods have community pools, and we will now allow community pools to be open as early as Memorial Day at 50% capacity and some other guidance there. Community tennis courts, or tennis courts in general, will be opened, which will be a really nice thing to have at this time of year. And also metro parks, and I'll let Ms. Odom talk a little bit about that, but community centers at metro parks and golf facilities and so forth will be open. And we're restricting gathering sizes to 25, and that's really important because it's really been shown that those larger gatherings of 50 and more is where a lot of the spread is happening currently. And so that's where the best practices have told us it's best to limit that at 25. And I tell you all that, and there's a lot I just threw at you, and I do want to highlight that if you go to our website, covid19.nashville.gov, you will see that we have really detailed descriptions, and I'm grateful to all the colleagues here at the mayor's office as well as in our public health department that have put together hours of efforts to put together very detailed 4 or 5 page guidances for each of these little areas that I just mentioned. So please visit that website, covid19.nashville.gov, for that. And here's why all this matters and why this conference right here, webinar matters, is Mayor Cooper ran as a neighborhood mayor. And as we look at neighborhoods, we want to have a great summer in our neighborhoods and a safe summer in our neighborhoods. And so with that said, you know, we want to provide as much guidance as you can so to let you know it's okay to have cookouts with your family, right? But remember, until there's a vaccine, we have to think about how we approach those types of things differently. Social distancing, you know, outside, spread your chairs around. Wear masks. The mask is really, as Dr. Caldwell has taught me, and I like really a respect of your colleagues. Keep your groups small. You know, I think while we're saying you can have large groups of 25 in phase 2, if you can keep them to 10 or below, that's more preferable. Doing it within your small social distance, whether it's social circle, whether it's a small group of friends or a family that really you kind of respect that you guys are your circle for a while. That will be a way to mitigate spreading this disease. Take care with food. I mean, I know I love big bowls of popcorn that we grab things out of, or Cracker Jacks. You have to think a little differently about how you do that now. Maybe don't put condiments out. Maybe if you maybe have everyone make their own individual, maybe have everything cut and placed in separate plates. So lettuce, tomato, cheese in one plate, lettuce, tomato, cheese in another plate, and then let people have one of those plates. So different ways to approach cookouts, for instance. At the community pools, I think we've mentioned that that's going to be allowed, and I'm really glad that that's being allowed. But please understand that when you approach the deck chairs and other things, that can still be a source of contamination. So think through about how do you clean those? How do you minimize the contamination there? Make sure you have ways to sanitize. That's really important. But chlorine in the water, great thing to do. And then community tennis courts and other things such as mini golf. Make sure you sanitize items between use. So if you're sharing a racket or a golf club, please think about sanitizing. Very important things. And I just tell you all that to say, yes, it's inconvenient, but please know that we want you to have a safe and fun summer. We want you to use your neighborhoods to get out and socialize. But if you just keep these few things that we just mentioned in mind, I think this will be a great summer, and we'll get back to a place where we can all enjoy the weather, and maybe it can help our soul as well, because I know this has been really hard. But we were only able to get here because of you guys. So thank you for everything you've done. And now I'd like to turn it over to Miss Jessica Fain of the YMCA. Thank you.
Thanks, Dr. Jahanger. I'll talk a little bit. You spoke about pools, and since you were landing on that at the end, I'll just say an encouraging word that if you're thinking about going to the pool this summer, whether that's a community pool or whether that's a YMCA pool, one of the things we're going to be stressing is, of course, that social distancing on the pool deck. It's not so much the activity inside the pool in the chlorinated water that is of concern as it is the social gathering on the deck. And so talk with your kids about the need to do that, because that will look a little differently than maybe what they've experienced at the pool in the summer in the past. And so the more that we can talk with our young people and our circles of friends about doing that, the safer we will all be. As it relates to phase 2 of the reopening, of course, day camps are going to be something that will be allowed in phase 2, and at the YMCA we'll be running those for sure starting on June 15th out at Camp Widgiewagon. We'll be, of course, taking a number of steps to limit the risk of transmission, including health screenings and the things that you're seeing in other locations, hopefully becoming accustomed to. Temperature checks for campers when they arrive, masks in most all areas, certainly masks for staff. And so just, again, taking those practices that we've been doing in other places and in our homes and in our neighborhoods and translating those into our summer camp opportunities. And so we'll be doing that as we do gradually open up those summer opportunities. Of course, since the beginning of this, really about 2 weeks after things closed down, we at the YMCA opted to turn 7 of our wellness facilities into emergency child care sites. So we have, for the past several weeks, been providing emergency child care for the children of essential workers. About 300 of them a week have been at those 7 locations, of course, using all the social distancing practices, reduced capacity, low staff to children ratios to be sure we can keep up with that routine cleaning. One thing I want to note today that we're very excited to be able to share is that care has been provided free of charge thanks to a contract with the Tennessee Department of Human Services, as well as contributions to the YMCA COVID Relief Fund. And we are going to be able to extend that free care for the rest of the summer through at least mid-August. So we will be extending that contract with DHS. We will continue to provide that care for our children of essential workers through, again, mid-August. If you're thinking about child care for the summer and looking at options or wondering what to expect about those safety measures that we'll be taking, that others will likely be taking, I would invite you to visit our YMCA Fun Company website. We've actually got a video there, and you can follow YMCA Fun Company on Facebook as well, and see just a typical day in YMCA child care, which will show you a lot of those practices, kind of help you know what to expect if your child is going into a day camp setting. Even though the video is not yet from day camp, those practices will be very much the same. So we would just invite you to look there. As was mentioned on the press briefing earlier this morning, as we move into phase 2, access to gyms will be allowed. We will be reopening our Davidson County facilities gradually in the coming weeks. But we also recognize that there are individuals that are not yet ready to go back to that setting, or maybe they don't belong to a YMCA or never joined. And we want neighborhoods to know that there's a number of resources available on our website to help you have a healthy and safe summer. If you visit our main homepage at ymcamidtn.org, in the very top navigation, you'll see a link for healthy living resources. And it'll land you on a page that has more than 300 digital workouts that are available Those are designed for all ages and all fitness levels, so there's a lot of resources and things that you can do from the safety of your own home if you're not comfortable going to a gym. We've also got an online library of resources for families. A lot of parents are, of course, caring for children in the home right now, and that can be a daunting task when combining with homeschooling. And as that virtual learning winds to a close at the end of this school year and you're looking for other activities, we've got about 40 different activities from various coloring pages that you can print out at home, as well as prompts for healthy meal conversations, things to talk about at the dinner table as you are sharing a meal together as a family. Lots of links to virtual museum tours and things that you can feel like you've taken a trip and not really have to leave home. So we would just encourage people to leverage those resources, to use them for their benefit while they're at home. And then for our senior population, we've also got an online library of resources for our active older adults. We'd invite them to visit those. Of course, those 300 digital workouts, there's some in there that are specifically tailored to that age group, but then there's a lot of other resources as well. And then finally, in terms of the resources that are available online through the YMCA, this is also a difficult time for all of us and our neighbors when it comes to our mental health. I mean, the strain and the stress that we're all under in living in unprecedented circumstances can be difficult, and we want to provide some mental and spiritual resources. So there is an online library of resources there that we would invite you to take advantage of. And so, and also to leverage the city's resources, that if you do need help for things, the mayor mentioned this morning, help for addiction and how deaths are more pronounced from overdoses during this time, and recognize that mental health is such an important part of our overall health. So we want to invite people to reach out if they need help and to leverage those resources that may be available online, even though you may not be going out into public settings in the community. And I'll end before I turn things over to Deputy Mayor Haywood with just a mention that we continue through the YMCA to operate 4 grab-and-go meal sites for families. We are going to extend that partnership with Metro Nashville Public Schools. We are very excited to be able to continue providing those meals throughout the summer, even though the school year has ended. So we're doing about 2,000 meals a day out of actually our Camp Widgewagon kitchen. And even though camp will be opening, they will still be able to do those meals. And so we'll have 4 locations. Families can pick up breakfast and lunch at Camp Widgewagon or at Donaldson Middle School, Paragon Mills Elementary, and there's one that just escaped me, but there are 4 locations we're going to continue to run at Glengarry Elementary. We're going to continue to run those throughout the summer. So with that, I think Deputy Mayor Haywood is going to talk more about some additional food resources that are available.
Good afternoon. I am Deputy Mayor Brenda Haywood, and I consider it an honor and a pleasure to be with you all here today to talk about the food security group that our mayor has put in force. And we're happy to share with you some of the pertinent information. We want you to know that Deputy Mayor Cooper has partnered with Second Harvest and MNPS to engage Metro Nashville school kids and their parents in being fed properly. We want you to know that the mission is that every child and every family will be fed to the fullest. We want you to know that nutrition is very important, and we don't want anyone to go to bed hungry. It is imperative that you know 1 in 6 adults go to bed hungry each night, not to mention that 1 in 4 of our youth go to bed hungry. We also want you to know that in partnering with Second Harvest, they partner with a plethora of agencies here in our community to make sure that their mission is accomplished. Not only are they there to feed individuals, we want to actually to stamp out hunger. We want you to know that when a child is hungry, their well-being has been compromised. We want you to know that learning is not as easy everything about that child has been compromised if that child is hungry. I want to tell you a little bit about who's involved in the food security group that Mayor Cooper has put in place. We want you to know that Kroger, Amazon, the Metro Action Commission, Vanderbilt Intern, Hands on Nashville, the Red Cross. We want you to know also that Lyft, and there are many chefs involved, United Way. We want you to know that there are several others, really too numerous to name. They've come on board and they were not even asked. They just wanted to be a part of the solution instead of being a part of the problem. And I also want to share with you some of the sites where the food is being distributed. Number one, we have Apollo, we have Bena Vista, we have Cole Elementary, DuPont Elementary, Glencliff High School, H.G. Hill Middle. We have IT Crestwell, Lakeview Elementary, Madison Middle. We also have McKissick. We have Napier Elementary. We have Rose Park. We have Schwab. And we also have Stratford High School. Two Rivers is among this particular group. And recently, Pearl Cone reached out to us and said that there is a drought in that area. So guess what happened? Ms. MacArthur facilitated a relief program there at Pearl Cone, which actually takes place at Westwood Church each Thursday at 5:30. Kids in the neighborhood and beyond can go to Westwood Church and get food. They can obtain food there. We want you to know that several of the fraternities and the sororities in our neighborhoods, they have also joined us in delivering foods. I was with the Kappas on today. They gave out 3,000 meals, of which they gave me 500 to give out in the Pearl Cone cluster. I want you to know that Amazon is a blessing to this initiative. Lyft, Metro Health Department, the Metro Action Commission has always given out food during the summer to kids that are in need. We want you to know that several of our barbecue places, they have collaborated to enforce Operation Barbecue, and they feed the homeless out at the fairgrounds. I took food there yesterday. They were immensely excited. We want you to know that there are restaurants such as Panera Bread, there's Chick-fil-A, there's Red Perch, downtown Nashville, that have all gotten involved. Thistle Farms, and we want you to know that Joel Sullivan is also an active member. Curb Records. Our mission today is to let you know that Nashville has stepped up to the plate. There's a lot that is being done, yet there's a lot to be done. We just invite you to get engaged in stamping out hunger in our city. And please know that I would be remiss if I didn't share with you that Oprah Winfrey has partnered with Tennessee State University and Bishop Walker, and she has donated $2 million to our community in terms of the hunger crisis. Oprah says feeding our young people is a necessity. We want you to know that the Rotary has given out several gift cards, $100 gift cards. They've given those gift cards to Second Harvest. Second Harvest, in turn, has given them out to Gideon's Army and other institutions and not-for-profits. There was one of my favorite people. His name is Mahatma Gandhi. He says that whatever change we want to see in the world, we must become a part of that change. So I say to you that a lot is being done. As Ms. Fain said, Camp Wiggy-Wagon, they're also giving out lunches and they're giving out breakfast each day, and they will be doing that for the rest of the summer. I also want to mention that Pastor Darrell Thompson out at Bass Street Missionary Baptist Church, he takes money out of his own pocket and he feeds the kids in Westchester. So we want you to get involved. We want to educate you, we want to inspire you, and we want to involve you. So get involved. We have a lot of kids and a lot of families that are going to bed hungry each night. Please be a part of the solution and not continue to be quite possibly a part of the problem. We thank you, Nashville, for all that you're doing, and we thank you, Mayor Cooper, for all that you're doing to make a difference in our community. Thank you. And at this time, we have Monique Odom. She's going to come in her own way, and we appreciate all that she's doing through the park system.
Dr. Jahanger, as we have walked through this very challenging time in our city and in our nation, we are thrilled at Metro Parks to know that we are beginning phase 2 of the reopening plan. And so with phase 2, with starting phase 2, there'll be a number of parks facilities that will be opening with capacity limitations. Those include community centers, nature centers, and golf course clubhouses, sportsplex. And so you will be able to find detailed information about those reopenings and all of the safety precautions that are actually being put into place and that we would hope that you would adhere to on our website at nashville.gov/parks. We have a number of program offerings, and they are free in Metro Parks. As many of you know, traditionally, we have a summer enrichment camp that is offered through our community center system. We will still offer that summer enrichment camp, yet we will pivot to a virtual format. And so we will offer breakfast and lunch as grab and go, as Jessica mentioned earlier. We will still offer the breakfast and lunch. Again, it will be grab and go. And then when youngsters and their parents or guardians are picking up their information, they'll get an activity pack for that day's a virtual activity. And those activities will start at a particular time, and we will provide instruction. Our summer enrichment program through the community centers will start June 8th, with registration taking place June 1st. And there will be information forthcoming about the registration process. Deciding to move to a virtual format was a difficult decision for myself and our leaders internally, because we know so many young people and parents rely on summer camps and supervision for their youngsters while they're away working and enjoy the enrichment of the program that it offers. So our program in particular will offer arts and crafts, fitness, sports, games, and play, and then STEM. That's science, technology, engineering, and math activities. It will be an 8-week program, and it will be at our all of our community centers. And as it has been in the past, it is offered for free. Again, our nature centers will reopen, and we're thrilled about that. And while we won't have meetings and activities inside, there will be some group activities offered outside. I neglected to mention at the top of my remarks that how much I appreciate our Nashville residents for supporting us and observing closures and doing the social distancing while we, again, walk through this very challenging time in our city and in our nation. We're very much looking forward to moving forward to phase 3 in the future, and looking forward to inviting you all back into our community centers, to our nature centers, and all of our facilities, sportsplex and the like. So with that, I will move forward and hand off to Mary Falls.
Thank you, Monique. Thank you, Monique. We're going to go to the question and answer portion of the webinar, and the first question is for Dr. Jahanger. And the question is, you're going to love this one: when will dog parks reopen? Director Odom, I did not send that one to you.
That will be. I would be happy.
Okay, we're going to let you take that one.
Okay, and then if Dr. Jahanger would like to come behind me, that would be great. So dog parks will open as soon as we know that we can open them and there's not an issue with community spread. One of the reasons that some of our outdoor facilities or features are closed, like dog parks and playgrounds and things like that, are because we noticed that there was overcrowding. I mean, it wasn't our ideal situation to close those. We actually had not intended to in the very beginning, but we noticed and got a number of reports and complaints of overcrowding. And I know that pet parents are excited, would be thrilled to have our dog parks open. People love our dog parks, and we love to have them in the dog parks. It is a situation where we are unable to, we are limited in our staffing and our resources and unable to really regulate or enforce and make sure that folks are safe at certain outdoor features. So as soon as we get the okay from the science that it's fine to do that, and we are not don't have an obligation of sorts to be out there and try to police or manage people, we will very happily open our dog parks.
Thank you. Thank you, Director Odom. The next question is going to be to Hugh Atkins, who's the head of the Environmental Division at Metro Public Health Department. And that question is, when will public bathrooms and water fountains be operational?
Okay. Thank you. Yeah, that's a challenging issue because, of course, it's a sort of a high-touch, shared by multiple people and hard to monitor. We are looking at that down the road in future phases, but for now, with all the other challenges of getting public places open, we're just not ready to move in that direction to open those facilities now, and we would encourage people to have their own individual water bottles if they're out in the parks and in places, but you can send us that through the suggestion box, and we'll take it under consideration for future phases. Thank you.
Our HOA pool is a swim at your own risk pool with no lifeguard or attendant. Are we able to open under Phase 2 without an attendant?
Yes. As you say, those types of pools are a different sort of classification already through the regulatory process through the health department. We rely on people posting lots of signs at those places already to let people know they are swimming at their own risk, that lifeguards are not on duty. So we would expect similar signs to be posted telling people to observe proper social distancing on the decks. The good thing about pools from a risk standpoint with COVID-19 is there's no evidence that COVID-19 is spread through pool water. So with the chlorine and properly sanitized water, it kills the virus. So we would expect, though, that those pools, while they're not attended, are monitored for proper levels of sanitation. So when whoever's in charge of maintaining your pool goes by on a daily basis or as often as they can, maybe somebody from the homeowners association or volunteers could go by and make sure that the deck chairs are being spaced out properly and maybe even wiped down more frequently than they would be. But you can open the pool without an attendant present.
Some questions for Dr. Caldwell, please. Will the homeless shelters be opening up again? We've seen an increase in the homeless population in Germantown to the point of overcrowding and unsafe conditions.
Well, the homeless shelter at the fairgrounds is open. There's a large capacity there for both men and women on the well side, as well as there's at the very far end of that fairgrounds, there's an area for people who are homeless, who are COVID positive, as well as people who are under investigation, whether they have symptoms or they're waiting for their test results. So we are working with the Office of Emergency Management to be able to address all of the issues regarding the homeless population at this time, and as well as with testing. We have very aggressively identified a number of people at the time at the rescue mission who were positive for COVID, and most, if not all of them, were asymptomatic. But that just shows that those types of environments are ones that we are very concerned about and will continue to monitor. And we're really grateful that everybody seems to be doing well at this time.
Can you explain further what you mean by daily testing that's required by employers to be testing their employees?
Daily testing is maybe something that would be ideal for that's a screening. Yes, I got it. Yes. Well, that's the temperature check. Yes, the temperature check daily that you would want. You're screening for people's signs or symptoms to see how they're feeling. We know a lot of people, though, can carry this COVID without having any symptoms. That's why we're asking people to wear the facial covering. It's required if you're an employee. It is required that you have signage asking everyone in the community to wear the face mask. Remember, the face mask shows respect for everyone you're around, because I am respecting you by protecting you by wearing the face mask. The face mask does not mean that I'm scared of you in any way. It means I respect you and I protect you. So the daily screenings are very important to be able to at least identify and address people that aren't feeling well. So they get tested quickly. They get moved out of anywhere anyone else is. Even though we know people who are asymptomatic can spread COVID, it's probably more likely that if you are symptomatic, you could probably even spread it more easily.
Dr. Janger, are there any plans to make it easy for neighbors to set up, quote, play streets, where streets are made safer for families to play in? Many parents are keeping their children close to home but still want them to play outside.
Sure, thank you. You know, I think it's a great thing for us to look at here in the mayor's office. I know there has been, I forget the exact name, but I think there's 8 streets recently closed for through traffic that allowed people to bike up and down, and I think those were fairly successful. So the idea that the person writing the question is mentioning sounds wonderful, and I will defer to our office here to evaluate that and see if we can set something up.
And they can do that at Hub Nashville?
At Hub Nashville, yes.
Another question, are there or have there been young people participating in shaping plans and decisions for summer learning and beyond?
Well, I think every step of what we've done thus far, we've had people across Nashville, young, old, experts in the field of business have impacted the decisions. The decisions specifically around summer plans and activities really involved some younger people, maybe in the upper teenage years, but also everyone involved has children and other people impacted in the decision making. So I've been involved, and I have 3 young kids. Mary has been involved; she has older kids, and I think and others. I just use the 2 examples of people sitting in this room. But yes, short answer is yes. People both older children and people who have younger children have been involved in all the planning.
Question for Jessica Fain. Ms. Fain, can you speak a bit more about what protocols will look like at summer camps and how those protocols will be communicated to young campers and their families?
Sure, I'll run through some of these protocols, but I'll start by just saying that we already have canceled our first 3 sessions of camp. So out at Camp Wichiwaga, the first session will be beginning on June 15th. And so between now and then, we'll be amending our parent guide that parents would typically reference on our website to include a lot of these protocols. So that'll be available in the coming days, as well as, of course, email communication to those registered participants who had already registered for camp, and then we'll be working with those from the first 3 sessions to try and find room on the back end of camp and accommodate as many of those as we can that were displaced by those cancellations. But just a few of the protocols, there are actually about 15 in all, so I'll try to be as brief as I can. We will be doing twice daily temperature checks for all campers as well as all of our staffers who are working at camp. This camp season, all of our campers will be divided into small groups of 10 with a camp counselor, and they will maintain that camp counselor throughout the duration of their camp session. So they will not switch up between counselors, and they will always be in a cohort of the same 10 children that are assigned to their group. Mask wearing is certainly going to become part of camp culture. We will have masks to provide to kids when they arrive at camp, but early on in the week, we'll be doing some arts and crafts activities with fun patterns and cloths and making your own mask so that you can keep that for the duration of camp. And those will be worn wherever it's not impractical or unsafe to do so. Of course, we won't be wearing masks for activities like swimming or high adventure and climbing activities or equestrian or sailing activities. But in most all other activities, kids will be wearing masks. We will also be requiring mask wearing in those groups of 10 as kids are moving from activity to activity, which would be the primary opportunities for them to be passing by other groups of 10, other cohorts. So we'll be asking that they wear masks at those times. Of course, for our day campers who ride a shuttle bus, there'll be reduced capacity there, and they'll be wearing masks 100% of the time that they're on the bus for transportation. We've installed additional hand washing and sanitation stations in all of our buildings and in several places on the ground so that we're incorporating both pre- and post-activity hand washing and then providing hand sanitizer while events or activities are taking place. We'll also be asking our campers to be gloved, and we will provide those when they're doing climbing activities on equipment that is frequently shared. And we'll be having counselors man all of our water bottle stations so that kids are not touching their bottles and spigots and those types of things. So we'll try to have a bit more control in how that happens to prevent cross-contamination. We're in the process right now actually of constructing 60 sets of 10-person bleachers that will be used to redesign group activities like camp songs and morning gatherings and campfires so that, again, that social distancing between those cohorts of 10 can be preserved. And we'll just do those. We want to make sure we provide that experience, but we'll just do it in a different way. We've also redesigned the interior a bit of our health center. We have a health center on campus at camp that is staffed all the time by a nurse. We've divided up those spaces such that we will be dealing separately with campers who might say, I don't feel well, versus campers who've got a bump, a bruise, a scrape, a bee sting, a wasp sting, something of that nature that needs to be treated by the nurse versus really not feeling so well. So we want to be sure that we're separating those populations whenever they're coming to the health center. Parent and vendor access, like many businesses, is just going to be restricted. All the check-in and check-out activity with parents is going to occur inside the car, and parents will not be coming into the main camp campus. We'll do all that before the children exit the car. And, you know, unfortunately, we're not going to be able to conduct our weekly parent program that we would typically do where parents visit camps because we think we'll all be safer if we limit the number of people coming on to the campus to really the staff that are there and the kids who are attending. We'll try to do some of that virtually when we're able to. All of our meals are going to be prepackaged as well. So there'll be no buffet lines. You'll see if you visit the COVID-19 website of the cities that all of the day camp guidelines are actually posted there. That is certainly one of them, that there either is not meal service or that those meals will be prepackaged and won't be served using shared utensils or materials. And then our camper interactions with their counselors and their movement from station to station and activities is going to be closely tracked just as a precautionary measure in the event that contact tracing becomes necessary were we to experience a case. So that will help us know on what days were kids in certain activities, what activity leaders were present when that happened. And a big message to parents that we will be sending in the couple of days is to really help us in that regard, because it's not necessarily just about the time that a young person is at camp from what we know about this virus. It's also about proactively monitoring your child's health and well-being 2 weeks before before they come to camp and 2 weeks after they come to camp. Because should they be symptomatic before or experience symptoms after, we'll want to proactively be able to communicate that with other campers that they may have been in contact with. So I know that's a long list and it's a lot, but those are the specific measures we're going to be taking out at Camp Widgewagon, and we'll be notifying parents of all those in the coming days as we prepare for that June 15th launch.
Thank you. Thank you so much. Next questions are for Hugh Atkins, please. Are fitness centers to be monitored while open, or are users expected to use the equipment at their own risk, much like pools?
Fitness centers are going to have somebody monitoring if there's management that can do that, and wipe down the equipment between each use. Lots of times now, the unsupervised gyms, it's sort of an honor system, I guess, that they do that. But it's imperative that somebody wipe those pieces of equipment down and not use shared equipment if you can keep from it on, weights and things of that nature. But that's the nature of that business, I guess. But it has to be sanitized, wiped down between each use. So if you've...
It's like a condo or something, they'll be expected to provide the material.
Yes, and somebody's telling me, yeah, if it's your condo association weight room or apartment weight room, make sure that it is stocked with the materials that will be needed for wiping down that equipment, and then maybe put a schedule together for somebody to go by, much like I said with the pools, to go by periodically and see what shape it's in, and that they could do that on their periodic checks. But they wouldn't have to have an attendant there.
Another question for you, Hugh. I'm going to eliminate some identifying information in this. There's a large athletic tournament being planned in Nashville in early July with, you're going to love this, 780 teams from across the country coming to participate. Is this something we should plan on having our youth participate in?
Oh, that's a tough one. And so much of this, we've spent lots of times talking to people about their events, and days maybe we're in a room and we feel like we're the official killjoys of Metro government. But we're just trying to keep everybody as safe as possible, and we are in this right now at a stage where it would be difficult to think that could happen by early July. Just the numbers that are in that question alone, and then you're talking about that many teams and that many parents and events that will be watched. I mean, crowds and things are really the things that cause issues with spread. And then basketball, by its nature being a taxing sport where the athletes are constantly huffing and puffing, and while basketball may, by the rules, not supposed to be a contact sport, we all know that it is heavily a contact sport. I just think when you take in all the risks involved in something like that, and primarily just the athletes and the crowds and the parents, it's just something that I don't think you can think is going to happen by early July.
Another question for you, Hugh, and this is a two-part question, and I'll have you do the first part and ask Monique Odom from Parks to answer the second part. Phase 2 says that day camps will be allowed to operate. However, playgrounds are not allowed to open until Phase 3. Could you address why that is?
Yeah, okay, yes. I have to get reminded sometimes. But yeah, the parks are making, they have their rules for their playgrounds, and they have the decision there with all things they have to consider with their personnel and their facilities. So there could be some differences in how the parks operate their playgrounds and just general playground equipment is being allowed to open.
Are HOA playgrounds open then?
HOA playgrounds
aren't they in
are
phase
open.
3?
Yeah, they can open.
Okay, they're open now.
Mhm.
Okay, thank you. So send the second part of this to Monique Odom. Monique, will day camps that use public parks during Phase 2 be able to use the public play equipment?
playgrounds are still closed in phase two. And if you recall, as I mentioned early on, I talked about a number of outdoor features in the parks being closed as a result of overcrowding and no adherence to social distancing. And we are heavily, again, relying on the science, but then too, also looking at the National Recreation and Parks Association best practices. And we do not have the staff to go out to outdoor facilities in particular, unfortunately, to sanitize those and make sure they're clean. That would have to be after every usage. So we don't have those capabilities right now, but we are very much looking forward to when many of those outdoor amenities, including playgrounds, are able to open and park users are able to self-regulate.
Thank you. Thank you. Next question is for Tom Sharp from the Health Department.
It's not in phase two.
The question is, when can youth sports open? And the answer is it's not in phase two and more to come. I think we got them all. All right, Dr. Caldwell, thank you.
Well, this brings us to the conclusion of our webinar. All of your questions that you put in the chat box, we really appreciate that. We want you to know that this is going to be archived so that we can share this information. There will be a link. I'd like to thank everyone who participated. Thank you for listening. Thanks to Mayor Cooper for putting this on for us, this special webinar on safe summer in Nashville neighborhoods, and thanks to Mayor Cooper for kicking it off personally. I'd like to thank Dr. Alex Jahangir, the chair of the Board of Health, as well as the chair of the Coronavirus Task Force. Thanks so much to Jessica Fain, the Chief Strategy Officer of the YMCA of Middle Tennessee. We appreciate you. And we appreciate Brenda Haywood, our Deputy Mayor, giving us some feedback about food resources. And of course, Monique Odom, the Director of Metro Nashville Parks Department, who provided us an overview of what's going on in the parks and pools and playgrounds. I'd like to thank also the Department of Health staff that joined me here today, our Director of Environmental Health, Mr. Hugh Atkins, Director of Government Affairs, as well as the Chair of the Technical Advisory Support Team on Reopening, Mr. Tom Sharp. Thank you very much. Thanks to all our Department of Public Health employees, and thanks to our great IT and AV team that made this possible, this webinar. We really appreciate you for all that you're doing to help us communicate and get all this important information out. And of course, Mary Falls from the Mayor's Office, who's put this together. Thank you all. We look forward to seeing you outdoors with our face masks on as we say, thank you, I respect you, stay socially distant, enjoy the outdoors, enjoy each other, but yes, keep it going. It's still a threat. We got a long way to go, but little by little, I think we're going to make it. Have a great rest of your day. Thank you.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.org.